We go now to our reporter. Laura Windsor has a subject important to women.
If you're like some women who experience painful and disruptive monthly periods because of heavy flow, there are treatments available. We spoke with Dr. Allyson Brooks at Hoag Memorial Hospital Presbyterian in Newport Beach, who gives us more information on heavy bleeding.
There are a number of reasons that women have traditionally undergone hysterectomies. The most common is bleeding, abnormal uterine bleeding, and which oftentimes results in anemia or fatigue and an unmanageable lifestyle. One of the other most common reasons was to treat fibroids, or they're called leiomyomas, which are benign tumors of the muscle of the uterus, but they can cause bulk symptoms, enlarging abdomen, pressure, discomfort, in addition to the bleeding. The final was prolapse, or managing relaxation of the pelvis, related oftentimes to childbirth, having multiple babies and sort of losing the supportive structures in the pelvic region. After having a conversation and doing an exam and getting some lab tests, specifically to look at maybe anemia or other hormonal assays, doing some imaging like an ultrasound, a pelvic ultrasound gives us a lot of information.
We asked Dr. Brooks, how is it treated?
We do have many alternatives to removal of the uterus, such as hormonal methods, an IUD, that's an intrauterine device that actually is coated with a hormone that can help diminish bleeding and pain. And then there are other surgical techniques that can remove polyps or fibroids or things that are causing the pain or bleeding. That are the two most common reasons that women in the past have wanted or needed to have a hysterectomy. Now we would say that if the hysterectomy is done for the appropriate indication, we typically will leave the ovaries there. And so we're just removing the uterus, or I call it the offending organ, you know, the organ that's bleeding or the organ that's causing pain or that has the fibroids, and allowing women to keep their ovaries and their hormonal function so that they don't have to worry about their bone health or their heart health or their sex drive.
Dr. Brooks talks to us about the robotic-assisted laparoscopic approach to fibroids.
You're using, you know, small microscopic instruments that can actually have a full range of motion. So there's less pain. You can really magnify the image, and resulting in less blood loss. And women do amazingly well with this procedure. To them, it feels very minimally invasive and quickly gets them back to their regular activities of daily living. I would say that the biggest advent, or the driver for reducing the number of hysterectomies that's performed, are two things. One is extending the age for which birth control pills are felt to be safe and acceptable to manage abnormal bleeding or pelvic pain or ovarian cysts or a variety of things. The other method is that of something called an ablation, or an endometrial ablation, which is an outpatient procedure that by heat destroys the lining of the uterus, which is the part that bleeds every month. So that ablation can be done as an outpatient in less than a half an hour, with losing that day out of your life only and returning to all your normal activities the next day, as a way to manage heavy periods or pelvic pain. So those two inventions, or you know, ongoing or more applied people, has dramatically affected the hysterectomy rate.
Women who are experiencing heavy uterine bleeding on a regular basis should consult with their doctor for the proper diagnosis and treatment. For the American Health Journal, I'm Laura Windsor.